Along with our anesthesia colleagues, we've done a lot over the last 10 to 20 years to try to reduce the pain as best as possible, but we can't eliminate it altogether. So what we've learned is attacking it from multiple angles is the best option. Using nerve blocks, using a multitude of medications instead of one type of medication can be really helpful for the patients. But again, we stress to the patients that they can't expect to have zero pain. There is going to be some pain with the recovery of the surgery, but obviously it lessens over time, and they obviously have a significant amount of pain going into the surgery that tends to get better as well. The better we can control the patient's pain, the quicker we can make them more mobile, the quicker we can get them home. So that's allowed us to get patients to their home in an outpatient setting by controlling their pain immediately from the moment we start surgery throughout the postoperative process. In the not too distant past, we used to keep patients immobile for 2 to 3 days to a week and allow their pain to subside naturally, whereas now we're controlling it in a more proactive way, and this allows patients to get up and move right after their joint replacement's completed within an hour or so.